Now let's take some time to go over the lower body terminology. We'll start with the pelvis. At the pelvis, you have some specific movements. The pelvis is what most people call the hips and is made up of the large bones here near the hips. There's a lot of subtleties in pelvic movement. As we've talked before, there's a tilt that can occur. So we have an anterior tilt where the hole at the top is rotating forward or anterior. We have a posterior pelvic tilt where that hole on the top of your pelvis is rotating backwards or posterior. This is one we'll use a lot with the posterior pelvic tilt to brace, like we talked about in our previous video. We also have the ability to tilt laterally. The way that I tell people to think about this one is pretend like your belt line is level, and when we do a lateral tilt, we're going to either raise and tilt that one way or the other way. So you can see this hip, this pelvis on the right lift and drop. So that is a lateral tilt of the pelvis. We then have the hip. We have flexion where we march up. We have extension where we're kicking back. We have abduction where we're abducting away from the body, and adduction where we're bringing the leg closer to the body. We also have internal and external rotation. External rotation is where we tilt the thigh outward and the toes will turn outward. Then we have internal rotation where we tilt the thigh inward and the toes will point inward. Then moving on to the knee, we have two simple motions here. We have flexion where the knee bends, and we have extension where the knee goes out straight. At the ankle, we have plantar flexion where we point down. We have dorsiflexion where we pump the ankle up. You then also have motions that are a little more subtle at the ankle where you can move toward the big toe or you can move away toward the pinky side of the toe. Eversion and inversion. Eversion, inversion. At the foot itself, you have a couple of motions here. When the toes curl, that's called flexion. And when we straighten them out or even extend them up, that's called toe extension. We also have another movement at the toes where you can spread them apart in this manner here. That is called abduction.